I provide an overview on the advances in molecular testing, particularly on detecting mutation, fusions, copy number changes in patients to provide targeted therapy, and also study mechanism of resistance to these therapies. And in that regard, pathology has contributed a lot by providing biopsies, rebiopsy from patients to study all those molecular analyses. Also, I think that the clinical pathology community has done an excellent job on trying to minimize the use of tissue for classic histology diagnosis, providing, of course, the best diagnosis possible, but saving tissue for molecular diagnosis of the specimen in our patients. So explain that. I know that there are challenges. It's not happening everywhere, but I talk from the positive side, from the perspective of what, how the field has evolved. And people during the conference also has expressed concern that this molecular testing doesn't happen everywhere. The incidence is not as high as it should be. But I think that, in my opinion, it's not pathology, it's not molecular pathology. It are the clinicians that actually not always aware of these advances and the need to provide this testing for our patients. Then I move on to some other advances in molecular pathology in lung cancer, particularly liquid biopsy, which is a new field for pathologists. They are sometimes not involved in this process of deciding tissue versus liquid biopsy, and I always try to say, I always say that people shouldn't use the versus, they should use or, and trying to integrate in the workflow of diagnosis, so offer the more timely and accurate diagnosis to the patient. And I ended up talking about the immunotherapy, of course, and the search or this saga to try to identify predictive biomarkers, and going from the PD-L1 immunohistochemistry to other genomic approaches like tumor mutational burden. And I provide a perspective how translational research molecular pathology in the clinical setting could help to identify predictive marker responses or mechanism of resistance that can, tell us how to treat the patients, in sequential approaches.